Question 1. A patient presents with chronic obstructive pulmonary disease with acute exacerbation. Which ICD-10-CM code should be reported? A. J44.0. B. J44.1. C. J44.9, J44.1. D. J44.9. Answer B. J44.1. This question tests your ability to select the correct ICD-10-CM code for a common respiratory condition. The keyword acute exacerbation is crucial here because it indicates a worsening of the chronic condition, directing you to a specific subcategory. ICD-10-CM guidelines require coding the specific condition, and J44.1 is the single code that captures chronic obstructive pulmonary disease with acute exacerbation. Always look for terms like with exacerbation or with complication, as they often lead to more specific and correct codes in ICD-10-CM. Question 2. A physician performs a Level III office visit for an established patient. What CPTE/M code should be reported? A. 99203. B. 99213. C. 99204. D. 99214. Answer B. 99213. This question tests your knowledge of CPT evaluation and management, E/M, coding for office visits. The important keywords are Level 3 and Established Patient. Established patient office visits are coded in the 99211 to 99215 range, while new patient visits use the 99202 to 99205 range. Code 99213 is the correct CPT code for a Level 3 E/M visit for an established patient based on either the level of medical decision-making or the total time spent. Remember to distinguish between new and established patients first when choosing an E/M code for office visits. Question 3. Which of the following body cavities contains the lungs and heart? A. Cranial cavity. B. Abdominal cavity. C. Thoracic cavity. D. Pelvic cavity. Answer C. Thoracic cavity. This question assesses your understanding of basic human anatomy, specifically body cavities. The keywords lungs and heart point directly to the location within the chest area. The thoracic cavity is the section of the body located within the rib cage that houses vital organs like the heart and lungs. Knowing the major body cavities helps in understanding anatomical locations described in medical documentation. Visualize the body to remember which organs are found in which cavity. Question 4. A patient receives an injection of Depo-Provera in the office. Which code set would you look in to find the code for the drug itself? A. CPT. B. ICD-10-CM. C. HCPCS Level II. D. E/M. Answer C. HCPCS Level II. This question tests your knowledge of the different code sets used in medical billing and coding. The crucial clue is code for the drug itself, indicating a supply or medication provided in an outpatient setting. HCPCS Level II codes, often called HCPCS, are used to report supplies, durable medical equipment, and drugs administered by a healthcare professional. CPT codes describe the services, ICD-10-CM codes describe the diagnosis, and E/M codes are a subset of CPT for visits. If you're coding for a drug or supply provided, think HCPCS Level II. Question 5. What is the term for a malignant tumor composed of cartilage? A. Osteoma. B. Chondrosarcoma. C. Myoma. D. Lipoma. Answer B. Chondrosarcoma. This question tests your medical terminology knowledge, specifically related to tumors and tissues. The keyword malignant tumor indicates a cancerous growth, and cartilage refers to the tissue type. Combining the root word for cartilage, chondro, with the suffix for a malignant tumor of connective tissue, sarcoma, gives you chondrosarcoma. Understanding common medical prefixes, root words, and suffixes can help you decipher unfamiliar terms. Question 6. A surgeon performs an appendectomy. Which section of the CPT manual would you most likely find the code? A. Evaluation and management. B. Anesthesia. C. Surgery. D. Radiology. Answer C. Surgery. This question tests your navigation skills within the CPT manual. The term appendectomy refers to the surgical removal of the appendix, which is a procedure. CPT is divided into major sections based on the type of service, and surgical procedures are found in the surgery section, which is the largest section in the manual. When coding a procedure, always start by identifying the type of service to locate the correct section in the CPT book. Question 7. According to ICD-10-CM guidelines, a principal diagnosis is defined as A. The diagnosis that is the most severe. B. The diagnosis that necessitated the patient's admission to the hospital. C. All diagnoses documented by the physician. D. The diagnosis listed first on the superbill. Answer B. The diagnosis that necessitated the patient's admission to the hospital. This question focuses on a key definition from the ICD-10-CM official guidelines for coding and reporting, specifically for inpatient coding. The keyword principal diagnosis has a very specific meaning in the inpatient setting. The principal diagnosis is the condition, determined after study, that occasioned the admission of the patient to the hospital for care. This is a fundamental concept for accurate inpatient coding and differs from the primary diagnosis used in outpatient settings. Knowing the official definitions is crucial for compliant coding. Question 8. Which modifier indicates that a physician assistant assisted in a surgical procedure? A. -25. B. -78. C. As. D. -59. Answer C. AS. This question tests your knowledge of HCPCS Level II modifiers, which are used to provide additional information about a service or procedure. The keyword is physician assistant assisted, indicating the role of the non-physician provider in a surgical setting. The AS modifier specifically identifies services performed by a physician assistant, nurse practitioner, or clinical nurse specialist assisting a physician. Modifiers are essential for accurate reporting and reimbursement, so familiarize yourself with the common ones. Question 9. The standard claim form used by physicians to bill for professional services is the A. UB04. B. CMS 1500. C. CMS 1450. D. ANSI 837I. Answer B. CMS 1500. This question tests your understanding of standard medical billing forms. The keyword is physicians to bill for professional services, which specifies the type of provider and service being billed. The CMS 1500 form is the standard paper claim form used by physicians and other healthcare professionals to bill for outpatient and professional services. The UB04 is used by institutional providers like hospitals. Knowing the correct claim form is fundamental for submitting accurate bills. Question 10. What anatomical term means away from the midline of the body? A. Medial. B. Proximal. C. Lateral. D. Distal. Answer: C. Lateral. This question assesses your understanding of directional terms in anatomy. The keyword phrase away from the midline of the body is the definition you need to identify. Lateral means situated away from the median plane or midline of the body, while medial means towards the midline. Understanding these directional terms is vital for correctly interpreting anatomical descriptions in medical reports. Think of the side, lateral, versus the middle, medial, of the body. Question 11. A patient is diagnosed with type 2 diabetes mellitus with diabetic nephropathy. Which ICD-10-CM codes are required? A. E11.22. B. E11.9, N08.3. C. E11.22, N08.3. D. E11.65. Answer: A. E11.22. This question tests your ability to apply ICD-10-CM coding conventions, specifically combination codes. The keywords type 2 diabetes mellitus and diabetic nephropathy indicate two conditions that are related. ICD-10-CM often uses combination codes when one condition is a manifestation or complication of another, and E11.22 is a combination code for type 2 diabetes mellitus with diabetic nephropathy. Always check the ICD-10-CM index and tabular list for combination codes when documenting conditions with associated complications. Question 12. Which CPT modifier is used to indicate that a procedure was bilateral? A. RT. B. LT. C. -50. D. -51. Answer: C. -50. This question tests your knowledge of CPT modifiers that describe where on the body a procedure was performed. The keyword bilateral means occurring on both sides of the body. The -50 modifier is specifically appended to a CPT code to indicate that the procedure was performed on both the left and right sides of the body during the same operative session. Using the correct laterality modifier is essential for accurate billing and reimbursement for procedures performed on paired organs or sites. Question 13. The term pathology is most accurately defined as the study of A. Surgical procedures. B. Diseases. C. Radiology images. D. Medications. Answer: B. Diseases. This question assesses your understanding of the basic definition of a medical specialty. The term pathology comes from the Greek words pathos meaning suffering or disease and logia meaning study of. Therefore, pathology is the study of the causes and effects of diseases. Understanding the fundamental definitions of medical fields helps you categorize services and documentation correctly. Question 14. According to CPT guidelines, what is the primary factor in determining the level of an E/M service when counseling and/or coordination of care dominates the encounter? A. The number of diagnoses. B. The complexity of medical decision-making. C. The total time spent with the patient. D. The type of history obtained. Answer: C. The total time spent with the patient. This question tests your understanding of the CPTE/M guidelines, specifically the role of time in code selection. The keyword phrase counseling and/or coordination of care dominates triggers a specific rule in E/M coding. When more than 50% of the face-to-face time for office visits or unit/floor time for inpatient visits is spent on counseling or care coordination, time becomes the controlling factor in determining the E/M level, regardless of the other components. Pay close attention to documentation indicating significant time spent on counseling or coordination. Question 15. A patient receives a blood transfusion. Which code set would you look in to find the code for the transfusion procedure itself? A. ICD-10-CM. B. HCPCS Level II. C. CPT. D. APC. Answer: C. CPT. This question tests your ability to distinguish between different coding systems and their uses. The keyword is transfusion procedure, indicating a medical service performed on the patient. CPT codes describe medical, surgical, and diagnostic procedures and services. While HCPCS Level II might be used for the blood product itself, the service of administering the transfusion is coded using CPT. Procedures performed by physicians and other healthcare professionals are typically found in the CPT manual. Question 16. The suffix ostomy means: A. Surgical removal. B. Surgical repair. C. Creation of a surgical opening. D. Inflammation of. Answer: C. Creation of a surgical opening. This question assesses your medical terminology knowledge, specifically focusing on surgical suffixes. The suffix ostomy indicates the surgical creation of a new opening, usually to the outside of the body or between two body structures. For example, a colostomy is the creation of a surgical opening in the colon. Learning common suffixes helps you understand the meaning of many medical terms related to procedures. Question 17. A patient has documentation of probable pneumonia. According to ICD-10-CM guidelines for outpatient coding, how should this be coded? A. Code confirmed pneumonia, J18.9. B. Code signs and symptoms only. C. Code pneumonia and a code for probable. D. Do not code until the diagnosis is confirmed. Answer: B. Code signs and symptoms only. This question tests your application of the ICD-10-CM official guidelines for coding and reporting in the outpatient setting. The keyword probable in outpatient documentation is a crucial clue. For outpatient encounters, do not code diagnoses documented as probable, suspected, likely, questionable, possible, or rule out as if they are confirmed diagnoses. Instead, code the signs and symptoms that led the physician to suspect the diagnosis. Always follow the specific guidelines for the patient care setting, inpatient versus outpatient. Question 18. Which of the following is a key component when selecting an E/M code based on medical decision making? A. Time spent with the patient. B. Counseling performed. C. Amount and/or complexity of data to be reviewed. D. Coordination of care. Answer: C. Amount and/or complexity of data to be reviewed. This question tests your understanding of the factors used to determine the level of medical decision-making, MDM, a key component in E/M coding. While time, counseling, and care coordination can influence E/M coding, especially time when it dominates, the amount and/or complexity of data to be reviewed is one of the three key elements specifically evaluated when determining the complexity of MDM, alongside the number of diagnoses/management options and the risk of complications/morbidity/mortality. Focus on the three core components of MDM when selecting an E/M level based on this factor. Question 19. In the CPT index, procedures are typically listed by A. Physician name, B. Anatomic site or procedure performed, C. Date of service, D. Diagnosis code. Answer: B. Anatomic site or procedure performed. This question tests your ability to effectively use the CPT Manual's index. The CPT index is organized to help you locate codes based on the procedure performed or the anatomical location involved. You would typically look up terms like appendectomy or knee or excision. Using the index efficiently is a fundamental skill for navigating the CPT codebook. Always start your CPT code search in the index before going to the tabular list. Question 20. Which form of anesthesia involves a loss of sensation in a specific region of the body, such as a limb or the lower half of the body? A. General anesthesia, B. Moderate sedation, C. Regional anesthesia, D. Local anesthesia. Answer: C. Regional anesthesia. This question assesses your understanding of different types of anesthesia. The keyword phrase loss of sensation in a specific region describes regional anesthesia. Regional anesthesia involves injecting an anesthetic near a cluster of nerves, numbing a larger area than local anesthesia but not causing unconsciousness like general anesthesia. Knowing the distinctions between anesthesia types is important for accurate coding of anesthesia services. Question 21. A patient is seen for a follow-up visit for hypertension and stable angina. Which diagnosis should be listed first for the outpatient encounter? A. Hypertension, B. Stable angina, C. It doesn't matter which is listed first, D. Code only the condition that required the most resources during the visit. Answer: A. Hypertension. This question tests your understanding of outpatient coding guidelines for multiple diagnoses. For outpatient encounters, list first the diagnosis, condition, problem, or other reason for encounter/visit shown in the medical record to be chiefly responsible for the services provided. While both conditions are managed, hypertension is often the primary reason for ongoing management in these scenarios. In outpatient coding, the first listed diagnosis reflects the main reason for the visit. Question 22. What does the acronym HCPCS stand for? A. Healthcare Common Procedure Coding System, B. Hospital Care Payment System, C. Health and Clinical Procedure Coding Standards, D. Healthcare Coding and Payment Solutions. Answer: A. Healthcare Common Procedure Coding System. This question tests your knowledge of the full name of a key coding system. HCPCS is an acronym for the Healthcare Common Procedure Coding System. It is a set of standardized codes necessary for medical providers and suppliers to bill for services and supplies. Knowing the full names of the coding systems is fundamental to working in medical coding. Question 23. Which modifier indicates that a service was performed by a resident under the direction of a teaching physician? A. -22. B. GC. C. TC. D. -26. Answer: B. GC. This question tests your knowledge of specific modifiers used in teaching physician environments. The keyword resident under the direction of a teaching physician is the key identifier here. The GC modifier is appended to services performed by a resident under the direct supervision of a teaching physician. Modifiers provide crucial context about how and by whom a service was performed. Question 24. The root word nephro relates to which organ? A. Liver. B. Kidney. C. Lung. D. Heart. Answer: B. Kidney. This question assesses your medical terminology knowledge, focusing on common root words. The root word nephro is derived from the Greek word for kidney. For example, nephritis is inflammation of the kidney. Learning common root words is an excellent way to build your medical vocabulary and understand the meaning of many different terms. Question 25. A patient has a fracture documented as non-union. How does this affect ICD-10-CM coding? A. It is coded as a routine fracture. B. It requires an additional code for complication. C. There are specific codes for non-union fractures. D. It is not coded until healed. Answer: C. There are specific codes for non-union fractures. This question tests your understanding of coding complications related to fractures in ICD-10-CM. The keyword non-union indicates that the fracture has failed to heal correctly. ICD-10-CM provides specific codes within the fracture chapters, typically under categories related to malunion and non-union, to report these complications. Always look for terms describing the healing status or complications of a fracture, as they will direct you to the appropriate, more specific code.